Hello, my name is Adele White. I am the Health Education Manager at Community Health. We are a free clinic located in Chicago, Illinois. And today we are going to be going over how to use a glucometer. If you are a community health patient that has diabetes and you have finished your diabetes education lessons or classes, or you have gone to appointments in the diabetes care group, you will get a glucometer, which is what you see in this picture right here. A glucometer is the machine that measures your blood sugar. So for anyone who's diabetic, it's really important that you be checking your blood sugar so you know what to do if you need to make your blood sugar go up or blood sugar go down. Check out our other videos on our health education channel for tips about controlling your blood sugar as a diabetic. The picture we have right here, this is the actual type of glucometer that our pharmacy gives to our diabetic patients. So we will be doing a demonstration about how to use this and also some written instructions if that's more helpful to you. This is just a picture of what the glucometer looks like with a test strip in it. So this is the machine called the glucometer, and this little blue thing sticking out of the end of it, this is a blood glucose test strip. This is where a person puts their blood, and the blood goes right here in this tiny little black slot on the white end. And then this machine reads the blood sugar and it'll come up on the screen like this. This picture over here is just shows what a box of test strips looks like. So this box has 50 strips. Patients of Community Health who have a glucometer will get 50 strips at a time also. Depending on whether or not you take insulin, insulin users get 50 strips every 3 months, and people who don't use insulin get 50 strips every 6 months. This is a really close-up look at a glucose test strip. And the reason I'm showing you this is because it's really easy to put the test strip in the wrong way in your glucose machine. So the part of the strip that looks like black with white stripes, this is the part that goes into the glucose machine. The other end that's mostly white with just a little black stripe down the middle, this is where your blood will travel. So it's really important when you're using a glucose test strip that you dip this part into your drop of blood. The blood travels all the way up to the end of this stripe, and that's how the blood is read by the machine. And this is just inside that box we saw on the last page. This is just a little canister that the test strips come in. This one's only 10, but usually you'll find canisters of 50 strips. If you are a community health patient and you would like to test your blood sugar more often, you can buy your own test strips. What's really important is that you buy these Prodigy no-coding glucose test strips if you want them to work with the glucometer that you've gotten from our pharmacy, which is the Prodigy Pocket Meter. What is kind of a pain is that glucometers, so your glucose machine, does not work if you use the wrong kind of strips. It's such a pain. I wish they were all interchangeable, but the Prodigy meter will only work with Prodigy strips. Be sure to pay attention to that. You can't buy CVS strips or Walgreens strips or a different brand. It has to be Prodigy if it's going to work in your Prodigy machine. This is just a little screen so you can see where you can buy them. Healthykin.com, Walmart.com, you can see the different prices. Amazon.com, ExpressMed. So most pharmacies like Walgreens, CVS, they don't carry this exact type of test strip on their shelves, which is kind of a pain. You can ask a pharmacy if you're going to go there often to buy it for you and carry the strips for you. They might say yes. So if you're able to order online, that's great. If not, check at your local grocery stores and pharmacies and Walmart to see if they have it. If they don't, they might be willing to purchase some for you if they know you're going to be buying it there on a regular basis. This is a really good close-up picture of a glucometer. This is not the one that you get from Community Health, but the whole point of this picture is just showing that this little strip that's in the middle of the test strip is how the blood travels up. So one mistake that people make when they first start testing their blood sugar is they do have a drop of blood that's not quite big enough. The drop of blood that you get on your finger needs to be big enough so that the blood can travel up this little line right here. If the blood does not reach the end of this line, that means the machine cannot read it. So you can see this person is sticking the end of their test strip right into that drop of blood so that the blood can travel up that line. This is just an example of one of the things you can use to prick your finger. So this type of lancet, anything that you prick your finger with is called a lancet. These are safety lancets. Safety lancets because it's really hard to poke yourself on accident with them, and you just use them one time. So there's lots of different brands of these. It doesn't matter what brand you use of these. All this is picking your finger. You normally twist and pull off the top, this part right here, or some of them you just pull it off. And then this button right here or right here is where you push down and the needle comes out. We're going to show you in the demonstration how this works, but these are pretty easy to use. Key thing is you only want to use them one time. You do not reuse this type of lancet. So this box of lancets is about $12 on Amazon, and in most stores it's around $14. You can find these very easily at bigger grocery stores like Jewel and Walmart and Target, and you can also find them online or at CVS or Walgreens usually too. This is just some more instructions about how to use a lancet. If you wanted to take a screenshot, feel free to take a picture of this screen. These are the different ways that safety lancets can look. On the next page is just some different kinds of safety lancets. So you can see even more than on the last page, there's lots of different kinds. We are showing you different boxes. And again, it does not matter what type of safety lancets you use. You can just go by price, that's fine, your preference. For these, you don't have to match the brand of the glucometer and the strips. All right, super, super important. With these safety lancets, once you push the button, the blade has come out and it has touched your finger. Now there is a little tiny needle exposed after you use it. You always want to throw away lancets and insulin needles as well, any type of needles that you're using, into a hard-sided container when you're done, because if you throw them into the regular garbage bag, they can poke through and hurt someone, and it can be very dangerous if blood or bacteria gets into someone else's body. So an old laundry detergent bottle is a really good option. An old coffee container or coffee tin is a really good option. And you always want to write on it contains sharps. And when you throw it out, when it's full, you want to duct tape the lid or with some really strong tape so that it can't be opened. This is just an up close look at what you do when using a safety lancet. You either twist and pull off the end of the cap, or you just pull off, it's a clear cap like this one, and then you're going to push the lancet directly against your finger. You can't have it not touching your finger because the blades are very, very, very short. It needs to be right up against your skin so that the needle can prick your finger. So I'm going to go through the steps before we do the demonstration. So step one, first you just want to get out everything you need to test your blood sugar. So you get out your glucometer, that's the thing that's measuring your blood sugar, this little blue machine. Your test strips right here. Prodigy no coating strips is what you need to use this Prodigy Pocket meter. A safety lancet or any kind of lancet. You need to make your hands clean before you do blood sugar testing. So here we're showing alcohol wipes. That's easy if you're on the go, but otherwise, if you're at home, you can just wash your hands with soap and water, or you can use hand sanitizer, whatever is convenient for you. And then a cotton ball is just to wipe off any excess blood after you're done testing. Really, really important for everybody, especially community health patients. You want to have this glucose logbook right with you and something to write with. This is really, really important for your doctor, nurse, your pharmacist to see when you go to visit the clinic for your checkups. When you are done testing your blood sugar, you want to write down your blood sugar number. Really important that your doctor, nurse, or pharmacist gets to see that number, because that's how they decide if you're doing really well, if they need to lessen your insulin, if you need more medicine or different medicine. So super, super important that you write down the correct numbers. Basically, if your doctor, nurse, or pharmacist can't see what numbers you've been having, they're going to have a harder time deciding what's healthiest for you and if anything needs to be changed. Another thing too is you'll see there's different days of the week here, and you can also write notes. For example, if you're feeling like your blood sugar is low, or maybe you're sick, or, oh, I didn't exercise today, I usually do, this is why my blood sugar is a little bit higher. There's a place for you to write down your sugars and to write down any notes that you'd like to. Step two, you want to go ahead and clean the finger that you're going to prick to get the blood sample. A lot of people find it easy to use these two fingers. So your second finger and your third finger. You want to wash your whole hand though, because you're going to be using your hand to do everything. So soap and water is fine. An alcohol wipe is fine, or hand sanitizer, just as long as it's something to clean your hand. Step 3. So preparing your glucometer and poking your finger. So first thing you want to do is you want to place the test strip just gently inside its slot. Don't push it all the way in. What happens when we push the test strip all the way in is the machine turns on and then it's ready for blood right away. Most of us can't prick our finger and get the drop out fast enough for the machine to not turn off again. So you just want to balance it in there delicately while we prep the rest of our stuff. We want to also massage our finger gently like this. For a lot of people, it's not easy to get enough blood out of our finger. I know whenever I get my blood sugar taken, I have to massage it quite a bit to get a drop of blood out. So doing something like this just makes the blood flow easier and it puts it to the end of your finger so it's easier to get out. Then, since your hands are already clean, you're going to take off the cap of your safety lancet and you're going to press the lancet directly against your skin and push the button on the end of the lancet so that the blade will stick out and poke you. People have different preferences on which finger to use. I find the least painful is kind of on the side of your finger, not directly on the tip. We also tend to put a lot of pressure on the tip of our fingers when we do everyday things. So I think on the side of the finger is a good spot. Now, once we've poked our finger, we are going to squeeze that same finger as long as we need to until a pretty good drop of blood comes out. Again, you don't want to have too small of an amount of blood or you're wasting a test strip because the machine cannot read it. So really, really important that you get a nice big drop of blood. Now that you have the drop of blood ready, you're going to push that test strip that you had balanced in the entrance of the glucometer. You're going to push it all the way in. When you push it all the way in, you'll hear a little beep, and then you'll see when the glucometer is ready, you'll see it has like little drops on the machine. It's saying, I'm ready for your drop of blood. So then you stick the test strip directly into the drop of blood. So the white part that you see, where's my mouse? The white part that you see right here, you want to stick this directly into the drop of blood so that the blood travels up this little line right here. And when you put the blood, if there's enough blood that travels up the strip, which there should be, your machine will tell you what your blood sugar number is. Step 5, you want to wait for the machine to show your blood glucose number. If it shows it, great. Wipe your rest of your blood off with a tissue and then go ahead and write that blood sugar number down in your blood glucose logbook. You see, it's kind of hard to see, but you'll see when you get the book in real life, there's the days of the week, and then you can write down whether you've taken your blood sugar number before breakfast, before lunch or after lunch, or before dinner, after dinner, or before bed. It's important for us to know when you've taken your blood sugar and when the last time you ate is, because that affects your blood sugar. Whether or not you're fasting or whether you've just eaten makes a big difference in your blood sugar. And then the lancet that you use, the thing you use to poke your finger, make sure you're throwing that away in a hard-sided container like a coffee tin, coffee can, or one of those empty laundry detergent bottles. For community health patients specifically, if you don't want to buy more strips, if you only want to use the strips that we give you, people who use insulin are going to get 50 strips every 3 months. To make those last, you want to check your blood sugar every other day. So if your doctor says to you, test your blood sugar every day, that's fine. But if you do that, just know that you're going to run out of strips before you're able to get more. If you're a person who is not on insulin, let's say you only use metformin or another one of those pills, but you don't use insulin, you're going to get 50 strips every 6 months. To make these last long enough before you get more, you only want to test your blood sugar twice a week. So again, you are always welcome to buy more strips if you'd like, but if you want them to last until you get more for free from us, from our pharmacy at Community Health, if you're a community health patient, you need to spread it out a little bit more. Bring this blood glucose logbook with your numbers written in it to all of your visits with your doctor, your nurse, or your pharmacist. It's super important that they see these numbers, otherwise it's really hard for them to know what's best for you going forward. This is the glucometer, the Prodigy Pocket Meter that you'll get from the pharmacy if you're a community health diabetic patient. We are going to show you how to put in and take out the battery. So there's a little compartment on the back that you open up, And inside, what kind of batteries this takes, they're little watch batteries. They're tiny little cylindrical batteries that go in a lot of small things. And there's a plus and a minus on it. The plus side goes up towards the ceiling. It also has tiny little plus signs inside the machine, but they are really hard to see. So you can just remember that the plus side goes up, or you can see it again in this video. So you're going to put in that battery, make sure it's nice and snug in the machine, and then close the door. And when you close the door, you'll hear a little beep probably from the machine. Now, what's good about this machine is if it sees you're not using it, it will turn off like that to save battery, which is nice. So now that we've put in our battery, it's time to use the machine. So here's an up close view of the meter. Again, while we're getting our blood ready, we're just going to lightly balance this test strip in the entrance. So you see I'm putting the black and white striped end into the machine, lightly resting it. I didn't put it all the way in, and I'm just going to set it down while I prick my finger and get everything ready. First step, I'm going to massage my finger a little bit. I'm going to clean my finger. In this case, I have an alcohol wipe, but again, you can wash your hands, use hand sanitizer. I'm just cleaning off that finger. I decided to use my pointer finger and massaging it more so that the blood flows to the end of my finger, because my fingers have a hard time bleeding. Every person's different. If you bleed easily, you might not have to massage it as much. This is my safety lancet. So I'm twisting and pulling off the blue end. And inside that you can't see is the little blade. Massage my finger once again. I'm pressing the safety lancet right up against my skin and pushing down. When I push down on the blue lancet, it pokes my finger. Now, this is a very small blade on this safety lancet, so I'm having to squeeze quite a bit to get enough blood out. There are safety lancets with different size needles. It just depends on your comfort level. The smaller needles do hurt less, but you might have to squeeze a little bit more to get more blood out. The bigger needles tend to hurt a little bit more, but you don't have to squeeze as much. So now that I have my drop of blood ready, I'm going to put the test strip all the way in. Oops, I dropped it. I'm going to put it all the way in. Again, the black and white striped side in. When I push it all the way in, I hear a little beep, and you can see that the machine turns on. When these little drops of blood appear, there we go, those little drops, then I know the machine's ready for my blood. So I'm going to stick the white part right into my drop of blood. So you see the blood traveled up that line in the middle. And then I'm just going to wait for my blood sugar number to come up. So you can see it says 92. As soon as I see that, I will take my test strip out of the glucometer, wipe off my finger, and I can record my blood sugar number in the blood glucose logbook. Okay, so now I'm just gonna make sure I note my blood sugar in my glucose logbook, and this is what I'm gonna bring to show my doctor, nurse, or pharmacist every appointment that I have at CommunityHealth. So that is it. I will put some more resources down below this video and some more instructions. Thank you so much for watching, and we will talk to you soon. Bye.